Hi, it's Dr. David Stoker, board certified plastic surgeon in Los Angeles with this nice 41-year-old mother of two. We just completed a mommy makeover on her about 5 weeks ago. She's doing really well and was willing to share her results with us. So we've covered up what you can see here, the areolar incisions healing beautifully. The vertical incisions and horizontal incisions underneath her breast here are healing great. You can barely see them even at this early point at 5 weeks. We did a large tummy tuck on her that included a diastasis repair as well as an umbilical hernia repair as part of that. We thought that since I would be looking right at that umbilical hernia as a part of the abdominoplasty procedure, it would be a good time to resolve that as well. We'll zoom in on this area for you to check out more closely in just a moment. You can see here, if I just lower this a bit, a very nicely concealed incision. It's fairly long here because we tightened up quite a bit of skin, removed almost probably about 10 inches of vertical height of skin here, as well as full thickness fat around this area. And I brought it back, designed that incision so that it would be perfectly concealed by her bikini bottom or the underwear she would typically wear, even if it were a visible incision. And this one, I would say, looks so great now, even at 5 weeks post-op, that I'm super optimistic about the final outcome. We also did liposuction to enhance this. There was liposuction in the waist here, I think a little bit in the axillas, where she had these little axillary puffs, and on the inner and outer thighs. And that really helped to tighten up things because she's, I'd say, somewhat shorter in stature, and it was hard for her to get that hourglass curve. But by treating her diastasis recti, by bringing in these muscles and also sculpting out the waist here and lifting her breasts up, now she gets that hourglass S curve that we were striving for. She's got beautiful skin too, and that makes it really nice for me to work with just as a material. So I'm really optimistic about how she's going to heal as the months go forward. You're telling me also you learned an important lesson, right? With these muscles being very tight here, there are certain things that you can't eat.
Right, don't eat too much.
Don't eat too much.
Your stomach will push on those muscles.
Yeah, in particular a salty steak dinner. That right there will cause you to swell. Doesn't feel so good in here. So, maybe have a little bit of that before surgery, but once it's tight, stick to the healthy diet. I'm super happy for you and doing so well, and excited about your future and how you're going to shrink up and be even less swollen as the months go by. Let's just have you turn her to the side again, get a nice side view here so you can see this, how much flatter this is. We'll show you the before and after pictures on a split screen in just a second. And then if you go the other way, check it out. You can see again, super nice improvement. We'll be keeping an eye on these scars here as they evolve. If they start to thicken in the least, we'll go through our laser protocol as well as our steroid injection protocol. In the meantime, she'll use a silicone gel on those scars to help to have them heal as well as possible. And then I just want to also get a quick zoom in live of this belly button and what it looks like here. Got a really natural appearing belly button here, even just 5 weeks out. It's not easy to do, particularly in this case, because she had an umbilical hernia there, which means that fat was bulging out from underneath the muscles and causing a bulge that kind of aches, and especially when you're doing exercise. So that's a medically necessary issue. In addition to that, the rectus abdominis muscles were split apart as what's called the diastasis recti. So in repairing and improving all of those features deep down, it affects the shape of that belly button and puts a lot of tension on the outside. So the fact that we've got a really nice looking shape here, as well as a scar line that is just inside the lip there of the belly button, so it's a lot more discreet, difficult to see. I mean, 5 weeks out, it's hard to even tell if this is an artificially created belly button, and I'd say with almost 100% certainty, it's going to continue to improve with time now. So congratulations.
Thank you. Super excited.
Yay. Dr. David Stoker, board certified plastic surgeon.